The next type of diagnostic test is a pulmonary function testing, or a PFT. Basic PFTs look at the flow and volume of air that goes into and out of the lungs to determine if there is a pathological occurrence. It's used to determine the degree of lung involvement in diseases such as asthma, emphysema, chronic bronchitis, COPD, cystic fibrosis, and the severity of neuromuscular diseases. Complex PFTs will measure the effectiveness of lungs at transferring gases to the blood system, and results of the PFT are accurate only with the appropriate patient effort. So if they're not compliant, it can be difficult to get an accurate assessment. Now the last one we're going to talk about is polysomnography. These are sleep studies. The purpose is to identify sleep disorders, such as those that interfere with breathing during sleep. As a patient sleeps, measurements are taken that evaluate the flow of air in and out of the nose and mouth, eye movement to determine the stage of sleep, and muscle movements needed to breathe. As the patient sleeps, we monitor the brain waves to determine the stage of their sleep, use an electrocardiogram graph to monitor the heart rate and any irregularities, and monitor the oxygen levels in the blood. So sleep apnea is one of the things that can be determined using polysomnography. So that's about to wrap up this last chapter of Pharm 109. So remember, diagnostic tests help to provide better picture of the patient's overall condition. The tests help determine diagnosis, prognosis, and improvement of disease condition, as well as aid in determining the effectiveness of the treatment. It is usually best not to diagnose solely on one abnormal diagnostic test. Even healthy individuals can occasionally produce abnormal test results. So I thank you for your participation in this course. I hope that you have learned and that you have found the medium enjoyable. And I look forward to seeing many of you very soon in the pharmacy technician program. So as this is the end of chapter 18, this is Miss Al signing off, and I hope to see you soon.